Hello everyone, Jennifer here. Today we are cracking the code for dysphagia. Dysphagia sounds like a scary medical term, but easily put, dysphagia means difficulty swallowing. Dysphagia can occur in all age groups, but I'm just going to be talking about dysphagia in the adult population. Since dysphagia is such a broad term, it needs special focused attention to determine just exactly why the swallowing difficulty is occurring. It's why some people with dysphagia have trouble swallowing certain foods or liquids, while others can't swallow anything at all. Dysphagia can present itself acutely, such as after a stroke or a head injury, or can worsen slowly over time due to cancer or dementia. Now, this is the part where you really want to pay attention. I'm going to give you the common signs that dysphagia or difficulty swallowing may be occurring in your loved one. These are the things that you want to be looking out for when they're eating. The first and the most obvious symptom of swallowing trouble is coughing or choking. This is the body's natural reflex in knowing what to do if something's trying to go down into the airway. I had a patient once tell me that, that swallow took the road less traveled when he was aspirating, and he was right, it really was. So that's the first and foremost thing you want to look out for. And this is something that you want to make sure is occurring quite often. I mean, a cough every once in a while is something to be mindful of, but this is something that you're going to want to really start worrying about if it's happening a lot. The next thing to look out for is a wet or gurgly voice, either during, while they're eating their meal, or even after. So it's important to have your loved one talk to you between bites. Ask them a question or have them tell you their name and just listen to see how their voice sounds. Another symptom is them bringing food or liquid back up. It can either come back up through and out their mouth, or even sometimes you'll see it out of their nose, which is known as regurgitation. Another thing, a feeling that food is getting stuck, either here in your throat. Another common place is kind of right here, or even further down into their chest. So if they tell you that they have pain in any of those areas, it's something that you'll want to keep an eye on. The next thing that you want to look out for is persistent drooling. If they're having a lot of that, this doesn't even have to just occur when they're eating. This may happen when they're just sitting in their chair. Just something to look out for. And lastly, unexplained weight loss or dehydration. I see this symptom happening more with patients that also have dementia as an underlying disease. Maybe patients aren't as hungry as they used to be, but this could indicate too that there's a problem that maybe they're not even expressing outwardly as a sign that you know about, but it's definitely something that could explain why they're not eating or drinking like they used to. Another common condition that causes dysphagia is called gastroesophageal reflux disease. That's a mouthful, isn't it? You can call it GERD for short. GERD is a condition that causes stomach acid to come back up your esophagus, and then sometimes it can find its way down your airway. So it affects approximately 20% of the population and is seen more likely in people who are overweight, who smoke, or who take certain medications. Dysphagia can be a very serious problem since it can lead to something called aspiration, or worse, aspiration pneumonia. First of all, let me caution you that anyone can aspirate. You probably have before, could have just been the other day. Have you ever eaten or had something to drink that you felt went down the wrong way, and then you spent the next 30 seconds hacking and coughing trying to get it up? Well, that, my friends, is aspiration. So now you know a fancy new word to show off next time it happens. Aspiration occurs when you inhale food, liquid, or even your own saliva into your lungs. You can also aspirate on food or stomach acid that comes back up into your esophagus, like some people do that have that GERD issue. Most of the time, aspiration won't cause symptoms other than just that sudden cough trying to get whatever it was that went down the wrong way back out. But if it happens over time, or if aspiration becomes chronic, it can lead to what's known as aspiration pneumonia. And that's kind of where this starts getting scary, because aspiration pneumonia is a condition where pneumonia develops after someone has inhaled food or liquid, causing bacteria to form in the lungs. People who develop aspiration pneumonia are at a much greater risk of developing the infection again, since most people also have other underlying diseases that also impair or impact their ability to swallow safely. This can definitely make the infection more difficult to treat, and unfortunately, if left untreated, or if the body is unable to fight off the infection, aspiration pneumonia can lead to death. So this is definitely not something you just want to overlook or say you'll get back to at another time. So if you're at home caring for a loved one, be watchful during meals. Check to see if they cough after swallowing their food or their drink. Pay attention if they tell you it hurts to swallow or if food feels stuck. If they have a red face or frequent watery eyes and it's not allergy season, keep a watch out for that too. If you suspect aspiration is occurring, schedule an appointment with their doctor as soon as possible. Because if food is finding its way into their lungs instead of their stomach, then they may be finding their way into a hospital bed. Now, before I go, I wanted to tell you about a little thing I will be doing at the end of each episode. I know I haven't gone over cognition yet. I think that's in two or three more videos coming up. But since this channel is called Cracking the Code, I thought I would let you all in on the fun too, by solving a cryptogram. Now, this is something you as a caregiver can do alone, or if your loved one likes delving into brain games, let them play along with you. I will attach a PDF version of the cryptogram down below so you have a copy, and I will post the answer to each puzzle at the bottom of the next episode. So, good luck in cracking the code. Hit the subscribe button down below, and if you'd like to be reminded when I upload a new video, hit the little bell symbol too.